Hey everybody, I just finished doing the grading for Module 1 and just wanted to give you some feedback in general. I did write feedback in your actual assignment link, so be sure to read that. For the first assignment, we had the evidence-based practice journal assignment, and I thought that went really well. It was interesting that most of you commented that clinical research was the least of the three components. Um, I'll pull that up, that you used. Um, you have clinical experience, you're looking at what the patient's input might be, but not really maybe looking at the research and integrating that into your plan, which is fine, and that's what we're learning to do. So I hope that this class will encourage you to do that. Some of you found some great articles um, for your examples for some of the other assignments. And I think that alone is demonstrating that you would reference those if you had a patient that fell into the categories of something that they were researching. So I'm looking forward to seeing how you integrate this in the future. I think that's all I need to note on that assignment. The second assignment was using the Pedro journal assignment. I thought everybody did a really good job on this. There were a few that could have expounded on why you put yes or no in a certain category. So in the future, if you're doing this for your research projects, then it really is helpful to put, if you put a yes, to explain why and really what was going on in that research study, rather than just maybe it was found in the methods section. Because it helps you sort out the articles in the future because you have to report on some of that criteria. The third assignment, let's see if we can find that, was the Pico journal assignment. And so you were practicing looking at some articles and stating some rationale, which I think most of you did good on. I wrote some comments regarding randomization, and then you created your own Pico question. I did put a few corrections in on your Pico questions. I didn't take off any points if I did put corrections on. We're just practicing at this point. And I want you to remember that in the future, when you do write your first official or first draft of your Pico question, that you'll probably be changing your Pico question a lot, whether it's before you do your literature searching or after, because maybe there isn't enough research on for your question that you developed. So just know that you may go through several drafts of your Pico question trying to formulate it for your project, and that's okay. So excited that week 1 or module 1 looked really good. As we look into module 2, it's titled Research Evaluation, and so you have one chapter to read. This is a fairly lengthy article. It might be helpful. It might not. Just use it as a reference if you need to. You have a post that's due Saturday, so that's a little different this week. And then your research evaluation journal assignment is simply some terms that we need to make sure that you're clear on and understand, different kinds of reliability and validity. But that's kind of like a vocabulary list. And then you have a sensitivity specificity journal assignment. So for this one, you're going to find 8 orthopedic assessment tests. So what I would encourage you to do is maybe look up tests that you've practiced before. So if you've done an anterior drawer on an ankle, look up that test. Or if you've done Hawkins-Kennedy on a shoulder, a handful of times, then look up that test. So we're looking up primarily special tests that you would perform in the clinic and what the sensitivity and specificity is of each assessment. So when you look for this, go ahead and just Google that right in. So what's the specificity and sensitivity of Lachman's or whatever your test is? And those numbers should be populated for you. So you come up with those and you don't have to calculate those. And then you have to write a statement on whether the information about this test increases or decreases the likelihood that you would use that special test in the future, and then explain why. It just helps to reinforce the concepts of sensitivity and specificity, and that's really what I want you to know at the end of this assignment, that you understand the difference and you're fairly fluent and you could teach somebody, an underclassman or a year one grad student, what is sensitivity, what is specificity, and maybe even moving into what are likelihood ratios and positive predictive values. So primarily those four terms to have a pretty good grip on. So your next assignment is due on Saturday for your forum. Everything else is due on Monday night. So hope you guys have a great week. Thanks.